Okay, folks, good evening. I'm Mary Sue Lanigan, and I'm the Executive Director at Michigan Parkinson Foundation. This is our regular Tuesday evening Parkinson program. I want to welcome all of you. Tonight, we have Wendy Jones speaking. Wendy owns Next Steps for Seniors. Wendy was kind enough to speak at one of our symposiums, I think it was in 2019, and did a great job. She talks about she will give you information if you are thinking about going into an independent living, assisted living, or a skilled nursing facility. She's going to talk about some guidelines, the questions to ask, issues to think about. So I now give you Wendy. I'm going to advance the next slide, right, Wendy? Just tell me. Okay.
Yes, thank you. Well, thank you everyone first. I appreciate the opportunity to speak with you and share just some things that might make life a little easier. I know that this is a very difficult time for many of us, especially our seniors during COVID. And I wanted to maybe make it a little easier by sharing some information and explaining the different types of senior living communities and then how COVID has affected these different communities and how it will benefit you in the long run. So I started my business 8 years ago in Rochester, and I've got over 25 years experience in the industry, in the healthcare industry. And every single place that we've ever moved anyone into, we have always visited first. So we're very familiar, my company and my team is amazing, very familiar with these different types of places. And as you can imagine, it's been a little different and more challenging during COVID because everything has changed pretty readily on the spot. So go ahead to the next slide, Mary Sue. So that's a little bit about me. The office is in Rochester, Michigan, and we cover Southeast Michigan right now. So we're able to help families all throughout Southeast Michigan. It is a free service, and the way I like to describe it is we walk alongside families, anyone coming out of the hospital, anyone living at home that is wondering if they should be looking at the next step. Our goal is just really to be there for these types of situations that come as we age. And the service is free of charge because we're able to not charge the families, but we actually get a referral fee from the community. So if you look at it like real estate, when you look for a house, you have a broker and that person does all the work for you. And then when you move in, that's when they get paid. So it's similar to that concept, just to share that with you. But our goal really is to walk you through the process so it's not so overwhelming. Anyone who's been through it, anyone on this call that has had a loved one, you know what I'm talking about. It's very challenging, and that's why I started the company 8 years ago. So basically there's 4 different types of different communities: independent living, assisted living, long-term care nursing home, and rehabilitation. So we're going to go through each one of those in a little bit of detail, and then I'll explain how COVID has changed in those different types of community settings, and then we'll definitely answer questions at the end as well. So the first one is independent living. Yeah, you can go to the next slide. So basically, an independent living community is very safe and secure. If you're living at home and you maybe need some socialization, or you're very lonely, or you forget to take your meds, or you just need some an opportunity to be with others. A lot of times being in the same situation with other people is helpful. But I like to tell people independent retirement living is really like an apartment. So you can get services, but you've got a nice size apartment, you've got a full size kitchen, you've got meals provided in the dining room. They will do light housekeeping for you, and they have various sizes. So I like independent communities. I had a lady who lost her husband and moved into the community because she didn't want to stay at home alone anymore. And she really thrived in the community because she was able to meet a lot of people and do activities with these women that were in the same situation as she was. So independent living is kind of like the first step from moving from your home. And many people do that. pretty flawlessly, I feel. The next one is assisted living, and the difference is, sorry, I forgot about the pictures. So these are kind of good pictures just to give you an idea. If you can picture, a full kitchen, you can cook, you can do all the same things that you're doing in your home in an independent living community. And I do think that they, like I said, they have studios, they have 1 bedrooms, and they have 2 bedrooms. So if you're coming from a large home, it's nice to be able to go into a 2 bedroom. It's usually 55 and older for an independent living community. Now, during COVID, you can go to the next slide, how it's changed in independent living is very interesting, because independent living communities are not licensed by the state of Michigan. And basically what that means is it's like an apartment. So we are able to have visitors in independent living communities. We are able to go to the dining room in independent living communities because we're exhibiting safety. We're staying 6 feet apart. A lot of times in the dining room, they might put 4 people at a large 8-top table so that they're separated. But I think that it's important to know that independent living is a great option for your loved one if they don't need a lot of care, and you want to be able to see them. Now, not all independent livings are allowing visitors, but I would gather to say probably 90% are, which is so nice, because many times we're struggling because we want to be able to see our loved one. And they do want you to have a test, but it's not absolutely required. So if you cannot get a COVID test for your loved one, it says on the slide, it might be required. So sometimes they ask and sometimes they don't, but in assisted living, it is absolutely required. So that's the difference between independent and assisted. Okay, you can go to the next slide. The assisted has a little bit higher level of care and obviously double the price. And I think that's important to know. Again, you can get more assistance. There is an RN usually on staff, whereas independent living, it's a separate care company that will be helping you with services. So you got to think of assisted as everybody in the care company is owned by the assisted living place. So it's a little easier to be accountable for some things that may or may not be happening in an assisted living. I love that there's a nurse there. If you need assistance bathing, if you need assistance toileting, all that stuff is very important in assisted living. And obviously the meds, the laundry, everything's being done for you there. Some of the assisted living places give you a 1 lump price, and some like to divide that out and separate the care costs. So it's all independent. And if you have questions on that, you can call my office and I can go through it. But there's a lot of assisted living communities in the state of Michigan. And they are all different when it comes to the pricing. But I would say the average price is probably $3,500 to $4,000 a month for assisted living. Okay, go ahead and go to the next slide. This is just an idea. Assisted living is going to be much smaller than your independent living community. So in the independent living community, you had the full kitchen and a kitchen table, bedrooms. This is basically 1 large room in assisted living. There are some that have a 2-bedroom, but there is no kitchen. There's usually a small kitchenette or a little fridge, that type of, maybe some cupboards and a sink, but there's not a full kitchen with the stove and everything you saw in the last picture. And everything has grab bars and it's very safe. You can see by this picture, the showers and everything are extremely safe in all of these types of communities. Okay, go ahead. Now you do have to have, because this is licensed now by the state of Michigan in assisted living, you do have to have the COVID test to get into a community. And they will not allow you in if you do have COVID into an assisted living. So I think it's really important, if you're coming from a hospital, and this is what's interesting, they actually are asking for that quarantine time for 14 days so that they can be sure that you don't exhibit any symptoms or anything comes up with COVID while you're in a community. The dining room is usually very, very limited, and they're delivering right now, from what I know, most assisted livings are delivering meals in like a box, like it's a box lunch they're bringing into the room. and people are still eating in the room alone. Now there are some, and I was at a community today that did have separate tables for each person, and they were allowed to come to the dining room for assisted living. But I think right now that's fairly rare still. I think that people are exhibiting a lot of caution with our seniors, obviously because of comorbidities and the fact that COVID is hitting them harder than most others. So, they are allowing window visits, patio and porch visits are definitely allowed right now. And in many cases, one loved one has been able to visit an assisted living, but they do go through every single precaution coming in. Okay, go ahead to the next slide. Now, nursing is a whole different level. And I know that everyone's been watching the news and knows how severe COVID has been in the nursing homes. Nursing home is like a mini hospital. They've got 24-hour care staff. They have, they can usually do IVs and wound care, medication management, injectables, those types of medications, all can be done in a nursing home. Hygiene is really, really important in a nursing home, and that's why some of our nursing homes have been hit so hard, is because of infectious disease protocols, etc., in the nursing homes. So right now, going into a nursing home is 2 COVID tests. I'm sorry, go to the next slide. I think I have some pictures first. Okay, nursing and rehab. So the difference, just so you're aware too, so the nursing home, the rehab is actually in the nursing home. So it's actually part of that whole program. It's usually a separate wing, and rehab is covered under Medicare, whereas the nursing home is usually a Medicaid or private pay scenario, but it's all in one area. Nursing homes, we've got 442 in the state of Michigan, and they are all, again, licensed by the state and monitored by the state. Okay, next slide. Yeah, here's a picture of, like, it's a little hospital, like you can see the bed is kind of like a hospital bed, but they try to make it a little warmer feeling in the rehabs and the nursing homes. There are single rooms and double rooms, and believe it or not, some nursing homes still have 3 people in them in one room, which is so sad to me. During COVID, the biggest thing that's changed is the visitation, and I think we all know that. Right now, you do need to have 2 COVID tests. You can only visit people at the window and outside. Now, I'm praying that is changing rapidly because the weather is changing rapidly. But right now, that's kind of where we are with nursing homes. I have not heard of many active cases anymore in the nursing homes. From what I've been hearing, they've decreased substantially. So I still know that many people don't want to move their loved ones into rehab or a nursing home because they can't physically go into the room and visit with them. And if they don't get a room that's on the exterior, you can't even see them because you don't even have a window. So if you do need to move your loved one into a nursing home, ask those types of questions. Can I have a first floor? Can I have a window? Those types of things if they have to go into rehab or into a nursing home. Okay, next slide. So the other option is private duty, and that's basically home care. And I'm sure this is on the rise, as you all know, because people are nervous about moving their loved ones maybe, and so they are paying out of pocket for caregivers or doing it themselves. So one of the concerns with private duty, just so you're aware, is they have had caregiver shortages right now. So we are in a time that is a little challenging currently with private duty home care companies. The average cost to get someone to come into your house to care for your loved one is about $23 to $24 an hour. And you're paying that to a company, not to an individual. And the reason you're paying that to a company is they're bonded, they're licensed, they're insured, they're going to take care of scheduling. If you think, and you can, just hire someone on your own to come in and pay them, $15 an hour. But I just want to make sure everyone is cautioned to that. it's definitely, if somebody falls or there's, gets injured on the job, there's no insurance, there's no coverage. If somebody gets sick, there's no one to cover. You're responsible for doing all of that. Whereas if you hire a company, they do all that for you. So those are kind of the differences between a home care company and you just hiring a personal caregiver to help your loved one. Okay, next slide. Now, during COVID, they have taken a lot of precautions. I think everybody has, specifically with testing. So many home care companies have their own testing systems and are able to pretty much send caregivers in there knowing that they are COVID free. I mean, obviously the caregivers will still wear masks. There's no restrictions as far as people coming in and out of the building. There's flexibility. So, I do think that people were nervous having caregivers come in their home in the beginning, but I think they're realizing the alternative, having them in a nursing home and not seeing them at all, they're tending to lean more towards home care right now because of the pandemic. If you can afford it, obviously the cost is fairly high for that. Okay, next slide. So there's a lot of different ways to pay for all of the things that we've been talking about. I mean, obviously, Medicare and Medicaid is basically, out of the hospital, or low income is Medicaid. But you also have veterans. If you are a veteran or your spouse was a veteran, and there's another slide later in this presentation that tells you how much money you can get from that. But I think a lot of people forget about the funds that are available through aid and attendance is the name of the benefit. And I do think that it's very, very beneficial for people. And if anyone has questions on that, we can cover it at the end. But I want to say thank you to our veterans and spouses for serving our country. We need you and we appreciate you, and I'm glad that there is a benefit for you. Long-term care insurance, I would say 5 to 10% of the people that call my office do have long-term care insurance of some sort that they purchased, and I do think it is beneficial, and financially it probably is a good idea if you don't already have it or can get it. Private pay, obviously, out of pocket is the last way you can pay for things. So that's kind of the financial scope of how things are paid for. Okay, next slide. So Medicare is basically the short-term coverage. So when you are in the hospital and Medicare is covering your stay, and you know about Medicare A, B, C, all the different plans, that's probably a whole nother presentation, but after a 3-day hospital visit, you go to a rehab stay. You can stay there for 20 days covered completely under Medicare. After 20 days, there's a copay, but you can go up to 100 days depending on your diagnosis and depending on your level. Like if you're doing well and you're not plateauing, so to speak, that will increase. So Medicare is a great program. Everybody over the age of 65 that's paying into Medicare has Medicare coverage, and I think it's useful. What people don't realize is it does not pay for assisted living. Medicare is not assisted living, that's private pay. So it's just important to know that up front. Okay, next slide. Medicaid is basically a low-income state and government-funded program. Really, the goal with Medicaid is to be in a nursing home and to utilize Medicaid long-term to have that coverage paid for in a nursing home. Now, there is a new program called My Choice Waiver that was designed to keep people out of a nursing home and into an assisted living and still get funds. But it is important to know you do need to qualify medically and financially for Medicaid. So I just want to make sure everybody understands that too. And again, we can ask more questions, but there is a 5-year look back period because many people were giving the funds away to their kids and then expecting to get it paid for through the state, and it just doesn't work that way. So they've got a lot of checks and balances with Medicaid. Okay, veterans, next slide. So we talked a little bit about veterans earlier. There are just a few key things to think of. They do need to have had 90 days active duty during wartime. The saddest thing in the world is the people that fell between maybe two wars and don't get the funds. So I just encourage you to get your DD 214. It's a document, and you can see when someone was discharged and if they were actually active during war times. I think it's a great benefit. I think the next slide, if you can switch to it, gives you the pricing and what's available financially during the wartime. Yep, see, there's our war times. So they do need to fall in these war times as that they served. Okay, next slide is the dollar amounts. And again, these change every year. So I think it's important to know these are last year's rates. I think they've gone up just a little bit. But it's a nice benefit, and this is a per month. So a surviving spouse can get up to $1,228 per month paid towards their community that they're moving into, which I think is a very good benefit to have. Okay, next slide. So I just wanted to share some of the things to be paying attention to. And I know many of you live this life every day, and sometimes we just need to see it visually and recognize that there are some things that we should be focusing on, or that maybe we need some extra support on. Obviously, you know, meal preparation, medication are some of the largest. Personal hygiene. If you notice that your loved one doesn't want to get in the shower or is having a hard time, you know, with the daily hygiene items, you know, these are things where we can bring support in. We want individuals to be as independent as possible, and wherever we can just bring support around them to help them with the things that they can't do is really the goal. Everybody wants to be independent and everybody wants to stay home, and that is our goal, truly. But if and when that time comes, we want you to know what your options are. And, you know, putting in safety equipment, emergency response systems. I think video cameras are a big thing now in spaces, so that, you know, we know if somebody's fallen to the floor, and, you know, your loved one will be called and you can get in there. The guardian alarm with the bracelet is another big one. I could tell you stories that would just break your heart. And I think that we just have to be smart. If you're alone and you don't have another person in the home with you, having some sort of security system is really critical. If you don't get to your phone, and everyone thinks we can get to our cell phones or that they're on us all the time, but something may happen when you can't actually get to the phone, and nobody knows that someone's on the floor for a period of time. So that's why I'm a big proponent of some sort of monitoring system, usually some type of bracelet, pendant, camera, whatever it takes to make sure that we're safe if you are alone in a home. Okay, next slide. So this just tells a little bit about what we do and how we can help you. You know, I really designed the company because people are so overwhelmed with this process. It's a very chaotic process. There's a lot of different terminology that's used. There's a lot of different, not a lot of time spent from social workers or people from the hospital that are moving quick and trying to get patients in and out. So I feel like we just needed personal attention, and that's why I started the company, so that people could actually have someone to talk to. Google is great, but my personal opinion, in a time like this, when you're very overwhelmed, you just want to sit in front of somebody eye to eye or on the phone and just have a conversation and ask questions. And so that's really why my team is there for you. I have 10 placement specialists. They're located all throughout Michigan. They'll come to your home. They will come meet you at a rehab or a hospital and just walk through different questions or processes and options, really lay the options out for you. We try to give every single family at least 3 options in their current situation so that they can look at what would work best for them. And then the team negotiates for you. I mean, we've been able to get some special pricing in some cases. We've been able to get some things that maybe wouldn't normally happen. So I think it's important to have an advocate, and that's really why our team is there for you as an advocate for you. Go ahead to the next slide. So this is my main contact information and phone number. The phone number is answered 24/7. We have a answering service that picks up in the evenings and on the weekends, and someone will get back with you very quickly. I think that talking to somebody on the phone is just way better than Google. I'm just going to be honest. I mean, you can't. And like I mentioned in the beginning, we go to every single community we have ever moved anybody in. We have a vetting process. And I think especially during COVID, because everything is changing so much, it's critically important to know what you're getting into. We had a family just the other day that said, I don't want to move my mom anywhere that I cannot go visit her. So we had to narrow that list down because we know which places you can and cannot go or get into. And there's hundreds of them, depending on location and what you're looking for. But that's why I think especially now, it's really critical to have an advocate for you. And I think the last slide is about my radio show. I have a radio program that it's called Next Steps for Seniors Radio every Saturday at 10 a.m. and Saturdays at 11, Sundays at 10. I have to get that time right. But basically, it's just giving resources, giving information, sharing things to be thinking about. Some people have listened to the radio and said, hey, I forgot that I needed to put everything in my trust. I thought that, but it was just a reminder because we had an attorney on talking about trusts. So that's the kind of stuff you'll get from the radio show. I do think it's beneficial for people just to gather information. And you can actually go on the radio podcasting site and you can listen to different programs from the past. One of my favorites is there's a nutritional gentleman who has a store in Rochester, and he talks about gut health, and he talks about, intake of food. So it's a different type of a program, but it affects everybody because we all eat every day. So anyway, just those types of things are on the radio program. So just know that it's available to you. You can tune in anytime to hear different things that we talk about on that show. And I think that's it. I mean, our goal really, and I want to be able to answer questions. I know that was about a 30-minute presentation, and I covered a lot of information. So I want to be able to answer questions because I know this is a very, very difficult time for a lot of people, especially our seniors and our families. So if there's anything I can help make easier for you, that's my goal today.
Thank you, Wendy.